My name is Austin Power and I'm the Senior Director for the Biologics Development Team at Jazz Pharmaceuticals. I've had the honour to work with my team to shape the RYLAZE manufacturing process. What you need to know about RYLAZE is that it is recombinant Erwinia asparaginase that will help meet the supply needs of the ALL-LBL community. RYLAZE is derived from a novel Pseudomonas fluorescens expression platform that produces an enzyme with minimal immunological cross-reactivity to E. coli-derived asparaginases.
Indication: RYLAZE, asparaginase Erwinia chrysanthemi recombinant RYWN, is indicated as a component of a multi-agent chemotherapeutic regimen given by intramuscular injection for the treatment of acute lymphoblastic leukemia, or ALL, and lymphoblastic lymphoma, or LBL, in adult and pediatric patients 1 month or older who have developed hypersensitivity to E. coli-derived asparaginase.
In my experience, manufacturing biologics can be a complex process. The living systems used to produce biologics can be sensitive to very minor changes in the manufacturing process. With this in mind, we wanted to achieve a consistent and reliable process while producing RYLAZE, which is why we partnered with trusted manufacturers who make use of state-of-the-art facilities, innovative, modern manufacturing technology, and the highest standard of production and quality control. Our modern manufacturing of RYLAZE utilizes Phoenix technology, which is a novel approach to recombinant protein production. To produce RYLAZE, recombinant Erwinia asparaginase is extracted from a common and non-pathogenic microbe. Our partner, AGC Biologics in Denmark, efficiently manufactures RYLAZE with technology developed at Phoenix, and that helps to produce high yields of purified product in as little as 3 weeks. RYLAZE is then filled and finished in the United States at Patheon Thermo Fisher in North Carolina in a sterile environment. This results in a ready-to-use, high-concentration formulation. We've developed an efficient and modern drug manufacturing process from start to finish, resulting in rapid and reliable supply. Our partnerships with Phoenix, AGC and Patheon help to ensure the high-quality product. And I can speak from experience that at Jazz Pharmaceuticals, we remain committed to redefining the possibilities with patients with ALL-LBL as we have been for 10 years. By choosing RYLAZE, you can rely on the supply you need for your patients when you need it.
Important safety information. Contraindications. RYLAZE is contraindicated in patients with history of serious hypersensitivity reactions to Erwinia asparaginase, including anaphylaxis, history of serious pancreatitis during previous asparaginase therapy, history of serious thrombosis during previous asparaginase therapy, history of serious hemorrhagic events during previous asparaginase therapy, severe hepatic impairment. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions after the use of RYLAZE occurred in 29% of patients in clinical trials, and it was severe in 6% of patients. Anaphylaxis was observed in 2% of patients after intramuscular administration. Discontinuation of RYLAZE due to hypersensitivity reactions occurred in 5% of patients. Hypersensitivity reactions were higher in patients who received intravenous asparaginase Erwinia chrysanthemi, recombinant, RYWN. The intravenous route of administration is not approved. In patients administered RYLAZE intramuscularly in clinical trials, the median number of doses of RYLAZE that patients received prior to the onset of the first hypersensitivity reaction was 12 doses, range 1 to 64 doses. The most commonly observed reaction was rash, 19%, and one patient, 1%, experienced a severe rash. Hypersensitivity reactions observed with asparaginase class products include angioedema, urticaria, lip swelling, eye swelling, rash or erythema, blood pressure decreased, bronchospasm, dyspnea, and pruritus. Pre-medicate patients prior to administration of RYLAZE, as recommended, because of the risk of serious allergic reactions, for example, life-threatening anaphylaxis. Administer RYLAZE in a setting with resuscitation equipment and other agents necessary to treat anaphylaxis, for example, epinephrine, oxygen, intravenous steroids, antihistamines. Discontinue RYLAZE in patients with serious hypersensitivity reactions. Pancreatitis. Pancreatitis, including elevated amylase or lipase, was reported in 20% of patients in clinical trials of RYLAZE and was severe in 8%. Symptomatic pancreatitis occurred in 7% of patients, and it was severe in 6% of patients. Elevated amylase or lipase without symptomatic pancreatitis was observed in 13% of patients treated with RYLAZE. hemorrhagic or necrotizing pancreatitis have been reported with asparaginase class products. Inform patients of the signs and symptoms of pancreatitis, which, if left untreated, could be fatal. Evaluate patients with symptoms compatible with pancreatitis to establish a diagnosis. Assess serum amylase and lipase levels in patients with any signs or symptoms of pancreatitis. Discontinue RYLAZE in patients with severe or hemorrhagic pancreatitis. In the case of mild pancreatitis, withhold RYLAZE until the signs and symptoms subside and amylase and/or lipase levels return to 1.5 times the ULN. After resolution of mild pancreatitis, treatment with RYLAZE may be resumed. Thrombosis, serious thrombotic events, including sagittal sinus thrombosis and pulmonary embolism, have been reported in 1% of patients following treatment with RYLAZE. Discontinue RYLAZE for a thrombotic event and administer appropriate antithrombotic therapy. Consider resumption of treatment with RYLAZE only if the patient had an uncomplicated thrombosis. Hemorrhage, bleeding was reported in 25% of patients treated with RYLAZE, and it was severe in 2%. Most commonly observed reactions were bruising, 12%, and nosebleed, 9%. In patients treated with asparaginase class products, hemorrhage may be associated with increased prothrombin time, PT, increased partial thromboplastin time, PTT, and hypofibrinogenemia. Consider appropriate replacement therapy in patients with severe or symptomatic coagulopathy. Hepatotoxicity, including hepatic veno-occlusive disease, elevated bilirubin and/or transaminases occurred in 75% of patients treated with RYLAZE in clinical trials, and 26% had grade greater than or equal to 3 elevations. Elevated bilirubin occurred in 28% of patients treated with RYLAZE in clinical trials, and 2% had grade greater than or equal to 3 elevations. Elevated transaminases occurred in 73% of patients treated with RYLAZE in clinical trials, and 25% had grade greater than or equal to 3 elevations. Hepatotoxicity, including severe, life-threatening, and potential fatal cases of hepatic veno-occlusive disease, VOD, have been observed in patients treated with asparaginase class products in combination with standard chemotherapy, including during the induction phase of multi-phase chemotherapy. Do not administer RYLAZE to patients with severe hepatic impairment. Inform patients of the signs and symptoms of hepatotoxicity. Evaluate bilirubin and transaminases prior to each cycle of RYLAZE, and at least weekly during cycles of treatment that include RYLAZE, through 4 weeks after the last dose of RYLAZE. Monitor frequently for signs and symptoms of hepatic VOD, which may include rapid weight gain, fluid retention with ascites, hepatomegaly, which may be painful, and rapid increase of bilirubin. For patients who develop abnormal liver tests after RYLAZE, more frequent monitoring for liver test abnormalities and clinical signs and symptoms of VOD is recommended. In the event of serious liver toxicity, including VOD, discontinue treatment with RYLAZE and provide supportive care. Adverse reactions. The most common adverse reactions, incidence greater than 20%, with RYLAZE are abnormal liver test, nausea, musculoskeletal pain, infection, fatigue, headache, febrile neutropenia, pyrexia, hemorrhage, stomatitis, abdominal pain, decreased appetite, drug hypersensitivity, hyperglycemia, diarrhea, pancreatitis, and hypokalemia. Use in specific populations, pregnancy and lactation. RYLAZE can cause fetal harm when administered to a pregnant woman. Advise females of reproductive potential to use effective non-hormonal contraceptive methods during treatment with RYLAZE and for 3 months after the last dose. Advise women not to breastfeed during treatment with RYLAZE and for 1 week after the last dose. Please see full prescribing information about RYLAZE available at rylazepro.com or from your Jazz representative.
Thanks for taking the time to watch this video about the RYLAZE manufacturing process. Okay, Michael, I think that's a wrap.
That was fantastic, Austin.